welcome to EuroPCR 2016. I'm very happy to have with us Professor Thomas Zeller, cardiologist and geologist from the University of Germany, to discuss the current evolution in the renal denervation. Thomas, what's the current status of the technology about renal denervation?
Well, basically, after the initial hype of renal denervation based on the Simplicity 1 and 2 studies, there's currently a kind of resetting period where we are re-evaluating the real benefit of renal denervation using different devices for invasive renal denervation as well as for non-invasive renal denervation due to the negative outcome results of the Hypertension 3 study.
What's the change in the procedure that you suggest according to the new knowledge about the distribution of the fibers?
Yeah, basically, when we started renal denervation, we had been taught to start and to denervate in particular close to the origin of the renal artery, but now we know that there is a long distance to the target. That means that the distance from the vessel wall surface to the nerves in the adventitia is the largest at the origin, and it's getting closer to the vessel lumen if you are going more distal. So the current strategy is to tackle the renal nerves in the distal part of the main trunk of the renal artery or going into the branches whenever the device technology allows it.
What are the key differences, very briefly, between the different ablation systems?
Well, we have number one, devices which are based on energy delivery, meaning heat delivery, which interrupt the renal nerves. This is number one, it's radio frequency. And number two, it's ultrasound. And then we have devices which act on a drug basis. That means they are injected by needle systems in the surrounding tissue around the renal arteries. And the drug which is injected is either selective, neurotoxic, or non-selective, generally toxic, and is interrupting the nerves which are circling around the renal artery.
What about the extrarenal ablation?
Well, that's a very attractive aspect, and at the beginning I was one of the most physicians who did not believe in this approach, because I'm used to do duplex ultrasound and I know how difficult it is to image the course of the renal artery. But nowadays it seems to be feasible to do it on a robotic-based fashion to exactly navigate ultrasound energy around renal arteries from outside using the CONA system.
And what would be the next step for renal denervation? Is there any future?
I believe so. What is currently ongoing is science, and this science is supported by a couple of companies. So there are currently 6 studies ongoing, meaning either recruiting or close to start recruitment, which are evaluating different stages of hypertension. Some are evaluating the early stage, meaning including patients off medication, and others are targeting to what we had been looking for initially, resistant hypertension patients. So I still believe that we will show efficacy in the near future.
Hopefully these studies will resolve all uncertainties about the renal denervation and help to find its place in the therapy of patients with hypertension.
I believe they will allow us to somehow define the place of renal denervation in the entire armamentarium of treating hypertension, but it will not be the final answer, because most of the studies are small studies regarding sample size, so they will give us a confirmation of the concept, but the sample size will not, most likely will not allow us to differentiate or to define differential indications, which kind of patient could be treated with the most benefit and which not. For that purpose we would need much broader follow-up studies.
For sure more research is needed, but at least these results will provide more insights in the role of renal denervation.
Definitely.
Thank you very much, Thomas.
You're welcome.